patient at Jefferson Northeast. I'm 92 years old, and for the past 10 years I've been treated for numerous illnesses, including hip replacements, pneumonia, vertigo, and more, at various hospitals. My most recent visit, I had excellent care to address my problems, and my nurse was Sherri French, who took care of me after my recent procedure, and she did not leave my side. My reason for writing is that I would be honored to nominate her for the Daisy Award. You never left her side. She has been to many hospitals, and by comparison, you have provided her with the best care she has ever received. My experience with other hospitals pales by comparison to the care I received at your hospital and from Sherri. The huge sign mounted on the wall in the entrance reads, "Here is at work." In all sincerity, I can attest to that. I hope she wins. Aww. Congratulations. So you are this month's Daisy winner.
I'm so honored.
And you're so surprised.
So surprised.
And you're so tired.
I am tired.
You want to tell everybody why you're tired?
Because I got called in at 2:45 this morning. and this is surgical head here.
So it's almost 12 hours later.
Yes,
so
yes.
You're entitled to be tired, but thank
yes.
you. Thanks for being here for the rest of the day.
Yes.
So that we could come give you the Daisy Award.
So nice. I'm so honored. I'm like speechless.
So tell me a little bit about you, I guess, to start. How long have you worked here?
So I have been at this hospital since 1987. I started as a nurse's aide, and then I went to area school of nursing. I worked on most of the units in the hospital, like this hospital's my family. I got my associate's degree and diploma from area school, Frankfurt Nursing School when it was Frankfurt. Then I went back to Penn State and I got my bachelor's degree, and then 2 years ago I just got my master's degree in education. And I presently teach for Jefferson and Holy Family University.
In addition to?
In addition to being a thrombectomy nurse 3 days a week, and helping out in interventional radiology, and loving our neuro team.
So you're busy. You're busy.
Yes, yes.
Busy.
New adventures. You know, I loved being a floor nurse, but I thought it was time for a change.
Yeah.
And it was a great change for me.
For sure. So obviously, you know, the patient that we talked about and who wrote the letter about you, you certainly had an impact on, but, you know, I've known you for a little while now, and, you know, I can personally attest to that. I think probably any patient who's ever been cared for you could write that letter, or some
So
semblance
sweet.
of.
Thank you.
But what do you think it is? Why do you think, particularly now, right? I mean, things are so hard for everybody, but particularly for our nurses. Why do you think you're able, or how are you able, to kind of sort of maintain that and maintain your sense of purpose and, you know, ability to really continue to so connect with your patients in a way that matters so much to them, obviously?
I think of my patients, I think, as my family, you know, taking care of them. And as a nursing instructor, I tell my students the same thing. Take care of that patient like it's your own family member. I mean, I've always loved the compassion. I always loved nursing. I always bond with my patients. I see my patients outside the hospital too, and they recognize me. But I mean, it's just a passion I've always had, and I feel, you know, every time I have a new patient, I feel like we always establish a good rapport. Of course, you have your good ones and your bad ones, but yeah, I just think of them as my family. This is how I want my family to be taken care of.
What is it in you, just as a person, and, you know, obviously as a nurse, that sort of sparks that or keeps that? Why? Why do you feel that way?
I think it's just, I've always wanted to be a nurse, and I've always had that passion. And not just that, everyone and all, I mean, I can talk for all the facilities, Frankfurt, Torresdale, and Bucks. I've made many, many friends. Everybody's my family. This is why I've been in this hospital. It's had so many different names, but you know what? I love working here. I love walking down the hallway and seeing everybody and knowing everyone, and everyone's just family. And it just makes my job easier. And I like every day just coming in and being the nurse that I really want to be.
Do a great job with it. How have you gotten through this last year and a half? I mean, obviously it's been awful.
It's definitely been awful. I started this job about a year ago, but I was just recently, my Jefferson students have been on step down. And let me tell you something, those girls do an amazing job. I mean, everyone in the hospital does an amazing job. Just now not being a floor nurse anymore, like I realized, like, wow, we all work really hard, you know what I mean? And I just think, you know, everyone in this facility does a great job. It's family. I love the compassion of being a nurse. I love my role change now, but I really, really look up to the girls out there still doing the floor nursing.
Well,
They're
and to
doing
your,
a great job.
to your point, the step-down unit, particularly here at Torresdale, has had, you know,
Yes.
almost
Yes.
exclusively COVID patients. for the
Yes,
last year
and
a
my
half, so.
students love the floor. They've learned so much. Everybody has been so welcoming to them up there.
I'm sure.
Definitely, yeah.
Sure. So if you, this will be my last question, then I'll
okay.
leave you alone.
That's all right.
If you could give advice to, you know, a nurse on his or her first day here at Jefferson Northeast, what would you tell him or her?
I would just tell them to be themselves, take care of your patients the way you would take care of your family members. Always ask questions, never assume anything. Just always let there be someone there to be a mentor to you. No matter how long you've been a nurse, you still have questions. And never, you know, just do the best you can do and be the best nurse that you can be.
That's great advice. And there's always someone to help you.
Always, always.
Always someone who knows.
Always, always.
Well, congratulations.
I am so honored. I thank you so much. I mean, I'm so excited that I won this, but I think all the nurses out there all deserve the Daisy Award.
I agree.
Absolutely.
I agree.
Absolutely.
Maybe we can figure out a way to do that.
Absolutely.
But on behalf of all of us, and certainly on, you know, from my perspective, you know, so well deserved.
Thank you so much.
You know,
So
you
special.
really do an incredible job every day and have for a really long time
Yes.
and through some difficult circumstances. So for everything you do every day, thank you. And
Thank you
we
so
really
much.
appreciate you.
Thank you so much. Again, I'm very honored, and thanks to everybody. Thank you.
You're welcome.